Okay, good morning. Thank you to all who are joining us on Facebook Live, as well as our press who are joined with us today. Today we will have a press conference today on monoclonal antibodies. My name is Angela Cabellin. I am the Chief Innovation Officer and Deputy Chief Administrative Officer. And just going through the lineup for today is County Executive Calvin Ball, Dr. Shafiq Ahmed, who is the President of our Howard County General Hospital, and Dr. Jeanette Nazarian, who's the Chief Medical Officer, also from Howard County General Hospital. Thank you for joining us. We will hear these remarks and then open up to questions from the press. Dr. Calvin Ball.
Thank you so much, Angela. Good morning, and thank everyone for joining us today here at Howard County General Hospital. Before we get underway today, I want to take a moment to thank and acknowledge the incredible nurses, doctors, technicians, and all of the staff who have worked tirelessly on the front lines to combat this pandemic. We're so lucky to have such a great institution here in Howard County, caring for our family, our friends, and our neighbors. Johns Hopkins University and Howard County General Hospital have been invaluable partners throughout this pandemic, treating patients, standing up testing, partnering with our community to reach vulnerable communities, and, of course, vaccinating our residents. We've made incredible progress over the last 4 months in getting our residents vaccinated, and the more of us who get vaccinated, the easier it will be to slow the spread and ultimately end this pandemic. Howard County was the first jurisdiction in Maryland, well, throughout our region, to reach more than 50% of our population partially vaccinated, a great milestone in beating COVID-19. We also have 99% of our residents 75 and older, our super seniors, vaccinated, and more than 90% of our 65 plus population vaccinated. These achievements are a testament to the collective effort to quickly reach our seniors and our most vulnerable communities. However, COVID-19 is still prevalent in our community, and for the many of our residents who are not yet vaccinated, it can still be a very serious illness. Today, we're here to highlight our partners at Howard County General Hospital, where we are now offering an innovative treatment right here in our county, monoclonal antibody infusion therapy. Now, monoclonal antibody infusion therapy can help prevent hospitalization or worsening of symptoms in certain patients with COVID-19 if administered early in the disease. Monoclonal antibodies are an important and helpful therapy offered right here at Howard County, and it can be life-saving. Throughout this pandemic, our team and private partners have collaborated and exhausted options to prevent the spread of COVID-19 and to ultimately save lives. This initiative at Howard County General is another important step to remove barriers to care and ultimately keep our residents safe. Thank you again to all of the extraordinary healthcare professionals, our nurses, our doctors, our technicians, and all of the staff for your investment in our community and working to keep us all safe today and every day.
Well, thank you, Dr. Ball. And I appreciate the kudos to our amazing staff here at the hospital, and they've been doing and are currently doing a wonderful job of taking care of our community and our patients with COVID. There has been an uptick in the past month, and we have been seeing more COVID patients. It's important to understand that although we've made a lot of progress on the vaccination front in this county, we still are asking our residents to continue to maintain caution as they are going around in the community. So it's important to remember that despite vaccinations, we are still asking people to wear a mask, keep distance with people that you don't live with, wash your hands, and stay home if you feel sick. So make sure we continue to enforce those things. And as Dr. Ball said, we are incredibly pleased to be offering the monoclonal antibody infusion therapy here at the hospital on an outpatient basis to adults who are referred by their primary care providers. Johns Hopkins Medicine has been providing this treatment in partnership with the University of Maryland Medical System at the Baltimore Convention Center and the field hospital that has been stood up there since earlier this year. What we strive to do is to make this more convenient for the residents of Howard County and all of our patients to be able to benefit from this therapy being offered locally here in the hospital, which is very convenient. Monoclonal antibodies are laboratory-made proteins that mimic the immune system's ability to fight off harmful pathogens such as viruses, and specifically in this case, COVID-19. When received within 10 days of symptom onset, monoclonal antibodies help prevent worsening symptoms and hospitalization in certain high-risk populations and patients who are positive with COVID-19. Both medications that we're offering are currently authorized by the U.S. Food and Drug Administration as emergency use authorization, which is consistent with the national use of monoclonal antibodies right now. I would like to, at this time, introduce Dr. Jeanette Nazarian, who is our Acting Chief Medical Officer and Vice President of Medical Affairs. And in her role as the Medical Director of our Intensive Care Unit, has been one of our COVID heroes, fighting alongside the other nurses, doctors, and staff, and working to take care of our sickest patients over the past year. Dr. Nazarian has been on the forefront of this and will go into more specifics about the monoclonal antibody therapy.
Good morning. Thank you, Dr. Med, and thank you, Dr. Ball. I'm grateful for the opportunity to be here. It makes me very happy in an era of our COVID pandemic to be able to tell you about the monoclonal antibody treatment that we're able to offer here at Howard County. As Dr. Ahmed said, I and the whole team at Howard County have been caring for COVID-19 patients now for well over a year. And we have seen firsthand, as I'm sure many of you have, the devastating toll that this virus takes. It has made people sick and it has caused an insane amount of death. So it's a great turning point to be able to say that we have a new way of fighting this virus. The monoclonal antibody infusion treatment is given here. As Dr. Ahmed said, it's given within 10 days of onset of symptoms and illness. A primary care doctor or a provider at an urgent care setting can refer a patient here. And once they get through our secure email referral system, we take it from there. I'm so grateful for the teams at Howard County that have set up this clinic. We've given it over 100 times since we started this on February 11th. And I know from national data and our own local data that we've spared a lot of people illness and hospitalization due to COVID-19. So I'll stop there. I'm happy to take any questions if anyone has any. Okay.
Are there any questions from the press? Okay, thank you all. There are no questions from the press, and this will conclude our press conference on monoclonal antibodies. Thank you all for joining from Facebook Live and for others. Thank you.